When someone we love begins to show small changes in behavior, energy, or health, it's easy to brush them off as just part of getting older. Maybe they've lost a little weight, seem more tired than usual, or aren't as interested in conversation or food. These signs often seem minor at first, barely worth noticing. But what many families don't realize is that these subtle changes can actually be early indicators that a person is entering the final stage of life. Death, especially in old age, rarely happens suddenly. More often, it's a slow, quiet process. The body usually begins to show signs months, or even a year, before someone passes away. The problem is, these early warnings are easy to miss. They don't always look dramatic or alarming, and because they tend to develop gradually, they blend into what we expect from the normal aging process. But hindsight often reveals the truth. The body was signaling a decline all along. For example, slight changes in appetite or energy might seem harmless. Maybe your loved one just isn't hungry like they used to be, or they nap more during the day. You might think they're just getting older, or they've earned the right to rest. While both of those things are true, they can also be masking something deeper. These changes can be the body's way of beginning to shut down, conserving energy and signaling that it can no longer operate at full capacity. Families often feel blindsided when their loved one's condition takes a sharp turn for the worse. But looking back, they remember all the signs: the quiet withdrawal, the skipped meals, the growing frailty. That's why recognizing these patterns early is so important. It doesn't mean giving up hope or assuming the worst. It means being present, being prepared, and being able to offer better care and deeper connection during what might be their final chapter. Understanding that the body sends quiet, early messages gives you an opportunity to make important decisions with love and intention. It allows you to prioritize comfort, have meaningful conversations, and create space for peace, rather than scrambling to react when it's already too late. It can also help you emotionally prepare, not just for the physical changes, but for the shift in your relationship, your role as a caregiver, and the time you have left together. The key takeaway is this: when someone you care about starts showing new or unusual signs, no matter how small, don't ignore them. Pay attention, talk to them, talk to their doctor. Even if it turns out to be nothing serious, you'll never regret being proactive. But if it does signal something more, you'll be grateful you noticed when you did. In the end, recognizing these early changes isn't about fearing death. It's about embracing the chance to love more deeply, care more gently, and make the most of the time that remains. One of the most noticeable and concerning signs that a person may be in the final stages of life, often within a year, is deep, ongoing fatigue and physical weakness. This is not the normal tiredness that comes after a busy day or a bad night's sleep. It's a kind of exhaustion that doesn't go away with rest and seems to linger no matter what. Even the simplest tasks, getting out of bed, walking to the bathroom, holding a conversation, can suddenly feel like overwhelming challenges. At this stage, the body is starting to conserve its limited energy. As vital organs begin to slow down, the body becomes more selective about where to direct its resources. It focuses on maintaining basic survival functions, which means there's simply not enough energy left for regular movement, alertness, or even digestion. As a result, people often start sleeping more throughout the day, taking longer naps, and feeling drained even after doing very little. It's also common to see physical weakness increase alongside this fatigue. Muscles may shrink from lack of use, and coordination may decline, making walking or standing more difficult. Someone who once moved around independently may now need help getting out of bed or using the restroom. They might appear frailer, struggle with balance, or start using assistive devices like walkers or wheelchairs. This decline can be sudden or gradual, but it usually becomes more obvious over time. Emotionally, this change can be incredibly hard, both for the person going through it and for the family. Seniors who were once proud of their independence may feel embarrassed or frustrated that they now need help with daily tasks. They may withdraw from conversations, cancel social plans, or stop participating in hobbies they once loved, not because they've lost interest, but because they simply don't have the energy. This fatigue can also affect their mood. Some people may become more irritable, while others seem distant or disinterested. These emotional shifts aren't personal, they're part of the body and mind responding to an intense, ongoing depletion of energy. Families often struggle with how to respond. It's natural to want to encourage your loved one to stay active or fight through it, but in many cases, that may do more harm than good. Instead, it's important to meet them where they are, offering rest, comfort, and patience rather than pressure or expectations. Recognizing extreme fatigue as a sign of the body slowing down allows families to shift their focus from fixing to supporting. This may mean adjusting daily routines, minimizing unnecessary tasks, and creating an environment that feels peaceful and safe. It also means cherishing the quiet moments, whether it's holding a hand, sharing a memory, or simply sitting together in silence. When fatigue and weakness become a daily reality, it's often a sign that the body is beginning its final journey. Understanding this helps you offer compassion instead of confusion, presence instead of frustration, and love instead of resistance. These are the moments that matter most, and recognizing them early gives you the chance to make them count. As a person enters the final stage of life, one of the most noticeable and distressing changes for both them and their loved ones is a shift in mental clarity and emotional engagement. This often shows up as increased confusion, forgetfulness, or a tendency to withdraw from social interactions, even among those who were once sharp, talkative, and engaged with life. These signs can begin to appear slowly, often months, or even a year, before death. At first, the changes might seem small. A person might start forgetting names, repeating the same questions, or losing track of time. They may struggle to follow conversations, become confused about where they are, or seem disoriented in familiar settings. While it's easy to dismiss these symptoms as just aging or mild memory loss, they often signal a deeper decline happening in the brain. The brain, like every other organ, relies on a healthy supply of oxygen and nutrients to function. As circulation slows and the heart weakens, the brain receives less of what it needs. This reduced flow can lead to changes in cognitive ability, thinking becomes slower, decisions harder to make, and information more difficult to retain. Some individuals may experience moments of clarity followed by episodes of deep confusion, almost like flipping a switch on and off. Along with confusion, many people begin to emotionally withdraw. This isn't because they no longer care, it's often because their brain no longer processes social and emotional cues the same way. Conversations can become exhausting, loud environments may feel overwhelming, and the effort to stay connected can be too much. As a result, people might stop initiating conversations, spend more time in silence, or retreat into themselves. Mood changes are also common. Some individuals may become easily irritated, anxious, or restless. Others may appear unusually calm or detached, even from things they once loved deeply. These shifts can be heartbreaking to witness, especially for family members who feel like they're losing their loved one mentally before they've physically passed. But it's crucial to understand that these changes are not a choice, they're a symptom of the body and brain preparing for the final transition. At this point, trying to correct or challenge their confusion often leads to more frustration for both sides. The best approach is gentle understanding. Meet them where they are. Speak in soft, calm tones. Don't force long conversations or try to reorient them aggressively. Instead, offer presence and reassurance. Hold their hand, sit with them in peaceful silence, play familiar music or share soothing memories. Even if they don't respond the way they once did, they can still feel your care and love. If you begin to notice these signs, increased confusion, withdrawal from others, emotional distance, it may be time to start preparing emotionally and practically. It's a signal that the brain, like the rest of the body, is beginning to slow down. Recognizing this allows families to shift their focus to comfort and connection, making sure their loved ones' final days are filled with peace, dignity, and love. One of the less obvious but deeply concerning signs that a person may be approaching the final year of life is a noticeable increase in how often they get sick, and how slowly they recover. Infections that used to be mild or rare suddenly happen more often. A simple cold lingers for weeks. A urinary tract infection returns just after it clears up. A small scratch takes forever to heal. These aren't just random occurrences, they're signs that the body's immune system is weakening. As the body begins to slow down in preparation for the end of life, it naturally shifts its focus. Energy is no longer directed toward full recovery or strong defense systems. Instead, the body starts preserving its remaining strength for basic survival. The immune system, which once worked hard to fight off illness, becomes sluggish and less responsive. That means infections can set in more easily and take longer to go away. Elderly people nearing the end of life may begin to experience frequent infections like pneumonia, urinary tract infections, UTIs, skin infections, or even gum and mouth problems. These are often recurring or difficult to treat. What once may have responded quickly to antibiotics now requires longer courses of treatment, or stops responding at all. In many cases, the illness never fully clears before another one begins. This cycle can leave the person feeling constantly tired, uncomfortable, or out of sorts. Poor circulation also plays a big role. As the heart weakens, blood flow to the extremities slows. This means fewer nutrients and less oxygen reach the skin and tissues, making it harder for the body to heal wounds. A small bruise or scratch might take weeks to fade. Bed sores can become a serious concern, especially if the person spends more time in bed or sitting still. These wounds, if not carefully managed, can lead to dangerous infections that are hard to treat and slow to heal. What's especially important to understand is that infections in the elderly don't always show up with obvious symptoms. A younger person with an infection might get a high fever, chills, or severe pain. But in older adults, the signs are often subtle. Confusion, loss of appetite, increased sleepiness, or a sudden dip in energy may be the only clues. Families may mistake these symptoms for simple fatigue or forgetfulness, when in fact, they could be the first sign of something more serious. At a certain point, the goal often shifts from trying to cure each infection to focusing on comfort and quality of life. Instead of pushing for aggressive treatments, it may be more helpful to provide supportive care, keeping the person hydrated, comfortable, and clean. Using soft clothing, skin moisturizers, gentle repositioning, and warm blankets can go a long way toward preserving dignity and easing discomfort. If you notice your loved one is getting sick more often, taking longer to heal, or seems more fragile after each illness, don't ignore it. These are quiet but powerful signs that the body is slowing down. Recognizing them gives you a chance to shift your focus to care, comfort, and meaningful moments, ensuring that your loved one's final season of life is met with peace, understanding, and love. As a person approaches the final stage of life, one of the clearest and often most concerning signs is a noticeable change in their breathing patterns and circulation. These shifts may start off small, barely noticeable, but over time, they become more frequent and more obvious. Understanding what these changes mean can help families respond with care, calm, and compassion. You might first notice that your loved one is breathing more slowly or more shallowly than usual. Their chest may rise and fall differently, or they might begin to take longer pauses between breaths. In some cases, their breathing may speed up for a moment and then slow down dramatically. One distinct breathing pattern that often appears in the final months or weeks of life is called Cheney-Stokes respiration. This pattern involves periods of deep, rapid breathing followed by moments of no breathing at all. Although it can be frightening to witness, this pattern is a natural part of the body slowing down. Another major sign that the body's systems are declining is poor circulation. The heart begins to weaken and doesn't pump blood as efficiently. As a result, blood flow is redirected toward vital organs, and areas like the hands, feet, ears, and nose begin to feel cold to the touch. You may also notice a bluish or mottled appearance on the skin, especially on the fingers, toes, or lips. These visual signs are clear indicators that the body is no longer distributing blood evenly and is conserving energy for its most essential functions. Shortness of breath is also common, even with minimal movement. Simple actions like sitting up in bed, changing positions, or having a brief conversation may leave the person feeling breathless. They may start breathing through their mouth more often or need to pause frequently while speaking. If they previously could walk across the room with no trouble, they might now struggle to do so without gasping for air. In some cases, fluid can begin to build up in the lungs. This can cause persistent coughing, wheezing, or a gurgling sound when they breathe. While it may resemble a cold or chest congestion for someone nearing the end of life, it's often a sign that the lungs are no longer functioning at full capacity. Lying flat can become uncomfortable, and many people begin to prefer sleeping propped up on pillows or in a recliner to make breathing easier. For families, seeing these changes can be alarming. The instinct is often to help, encouraging deeper breaths, calling for emergency care, or trying to fix what's happening. But in many cases, these symptoms are simply part of the natural process of the body shutting down. While there may be medical interventions like oxygen therapy or medications that offer relief, the primary focus at this stage should shift to comfort. Keeping the room cool and quiet, using a humidifier, helping them sit in positions that make breathing easier, and offering sips of water can make a significant difference. Gentle reassurance, soft touch, and a calm presence can do more than words ever could. If you notice these signs, changes in breathing, cold hands and feet, pale or bluish skin, it may mean your loved one is nearing their final moments. This is a time to offer peace, not pressure, presence, not panic. Your love and care are the most meaningful gifts you can give. Another often overlooked sign that an elderly person may be approaching the final stage of life is a gradual emotional detachment and a noticeable loss of interest in the world around them. While physical decline is easier to spot, emotional and psychological changes can be just as telling and just as meaningful when it comes to understanding what's happening internally. You might notice your loved one beginning to withdraw from activities they once enjoyed. Whether it's reading, watching their favorite shows, gardening, or spending time with family, things that used to bring them joy now seem to matter less. They may stop asking questions, participating in conversations, or showing curiosity about what's going on in the world. This isn't just boredom or moodiness, it's often a sign that their focus is turning inward. This emotional shift can take many forms. Some individuals may appear distant or distracted. Others may seem more content in silence, spending long stretches of time alone, sometimes staring off into space. While it can be heartbreaking for family members to see their loved one disconnect in this way, it's important to recognize that this detachment is not always a sign of sadness or depression. In many cases, it's simply the body and mind preparing for closure. As the end of life approaches, the brain begins to conserve energy. Emotional processing becomes more difficult, and social interaction can feel overwhelming. This is why conversations may seem harder for them to follow, and why they might respond with short, vague answers, or not at all. Some people may even stop making eye contact or recognizing people they've known for years. These changes are not a lack of love, but a reflection of the brain's decreasing ability to process and engage. In some situations, emotional detachment is accompanied by a sense of peace or acceptance. Your loved one may stop worrying about everyday things and speak more openly about memories, spiritual beliefs, or people they've lost. These quiet moments often become deeply meaningful, as they reflect a person coming to terms with the natural end of life. Others may express fear, confusion, or sadness, especially if they sense that something is changing but can't fully understand or explain it. What's most important during this time is presence, not pressure. Instead of trying to pull them back into the world, meet them where they are. Sit quietly with them, hold their hand, play soft music, remind them that they're not alone. Sometimes, simply being there without expecting conversation or reaction is the greatest comfort you can offer. If you notice your loved one withdrawing emotionally, becoming less interested in life, or seeming more at peace in solitude, pay attention. These are often signs that the end is drawing near. It's a tender time to offer reassurance, to share your love without needing words, and to allow them the space to move gently toward closure. As the body begins to prepare for the final transition, one of the less obvious but very telling signs is a noticeable change in sleep patterns. Many families may notice that their elderly loved one starts sleeping more during the day, staying awake at night, or experiencing bouts of restlessness that weren't present before. These sleep disruptions are not just signs of aging, they can be a signal that the body is slowly winding down. At first, the changes might be subtle. You might see your loved one taking more frequent naps during the day or struggling to fall asleep at night. Over time, these shifts often become more pronounced. They may sleep for short periods and then wake up feeling disoriented. Some begin to experience what's known as terminal restlessness, which includes tossing and turning, picking at blankets, fidgeting, or even trying to get out of bed repeatedly. These movements are not always conscious and can be distressing to witness. There are a few reasons why sleep becomes so disrupted in the final stage of life. As the body's systems slow down, the brain begins to lose its natural rhythm of wakefulness and rest. The internal clock that helps us know when to sleep and when to be alert becomes less reliable. Pain, discomfort, medications, or decreased oxygen levels can also contribute to broken sleep and nighttime agitation. Even the emotional and spiritual process of coming to terms with mortality can create inner unrest that manifests as physical restlessness. In some cases, your loved one may begin talking in their sleep, having vivid dreams, or even speaking to people who aren't physically there. These moments can be unsettling but are quite common. Many people report their loved ones seeming to have one foot in this world and one in another, talking to deceased relatives or referencing places they once knew. Whether or not you believe in the spiritual meaning of these moments, they often provide comfort to the individual and, in many cases, to the family as well. For caregivers and family members, it's important to create an environment that promotes calm and reassurance. Keeping lights dim at night and bright during the day can help regulate some sense of routine. Playing soft music, reducing noise, and using gentle aromatherapy like lavender can also help reduce restlessness. If pain or anxiety is part of the reason for poor sleep, working with a healthcare provider to adjust medications can make a big difference. But perhaps most importantly, try to remain calm and present. If your loved one becomes restless or confused during the night, reassure them with a gentle touch, soft words, or simply by sitting quietly nearby. These small gestures provide a sense of security and connection, even when communication is limited. Changes in sleep patterns are more than just physical, they're a signal that the body and mind are letting go. By recognizing these signs, you can provide comfort, minimize distress, and help your loved one rest peacefully in their final days. As someone nears the end of life, one subtle but important change to look out for is a noticeable loss of interest in personal hygiene and everyday routines. Things that were once part of your loved one's daily life, like bathing, brushing their hair, changing clothes, or even engaging in simple hobbies, can slowly begin to fade away. While it might be easy to assume this is just laziness or forgetfulness, it's actually a sign that their body and mind are beginning to withdraw from the world. In earlier years, many seniors pride themselves on looking presentable and maintaining their personal routine. But as energy levels drop and the body starts to slow down, even basic self-care can feel exhausting. Brushing teeth may seem like a chore, getting dressed might feel overwhelming, and showering can become physically difficult or emotionally draining. What was once a habit becomes something they either avoid altogether or need assistance with. This change isn't just about physical fatigue, it also reflects emotional and psychological shifts. As the brain processes the body's decline, motivation naturally diminishes. The desire to keep up appearances fades because the person is no longer focused on the future or the outside world. Instead, their attention turns inward. In many cases, this signals a deeper understanding, conscious or unconscious, that their time may be limited. You may also notice that your loved one stops participating in the activities they once enjoyed. Someone who loved gardening may no longer go outside. A person who watched their favorite TV shows religiously might now let the television play in the background without really paying attention. Meals may become something they no longer look forward to. Reading, puzzles, phone calls with friends, these all begin to slip away. This emotional withdrawal can be difficult for families to watch. It may feel like your loved one is giving up or disconnecting. And in a sense, they are, but not in a way that should be judged or feared. It's part of the natural progression as the body and mind prepare for the final transition. Their world becomes smaller, quieter, and more focused on rest and routine. As caregivers or family members, the best approach is to meet them with compassion rather than correction. Instead of pushing them to shower or scolding them for not changing clothes, gently offer help and reassurance. Create a routine that feels manageable. Use warm, comforting towels, favorite scents, or soothing music to make hygiene feel like a treat rather than a task. Focus on dignity, not perfection. The loss of interest in personal hygiene and daily activities is not a sign of defeat, it's a reflection of where they're in their journey. By understanding this change, you can support your loved one in a way that prioritizes peace, respect, and love over routine and appearance. In these final stages, what matters most isn't how they look, it's how they feel. Your patience, presence, and kindness can bring more comfort than any perfectly styled hair or pressed outfit ever could. Another significant but often misunderstood sign that someone may be approaching the final stage of life is a noticeable change in their sleep patterns. You might see your loved one sleeping more during the day, dozing off at odd hours, or waking frequently throughout the night. At first, these changes may seem like typical signs of aging or boredom, but they're often a deeper signal that the body is conserving energy and preparing for the natural process of shutting down. In a healthy adult, sleep helps the body recover, recharge, and stay regulated. But for someone in physical decline, sleep becomes less about recovery and more about preservation. The body begins to prioritize its remaining energy toward the most basic, essential functions: breathing, circulation, and maintaining internal balance. Everything else, including mobility, digestion, and mental activity, starts to take a back seat. You may notice your loved one spending longer hours in bed or resting quietly in a chair. Naps may stretch into hours, and nighttime sleep may become fragmented. It's not uncommon for them to be awake for short periods, only to fall back asleep quickly. For some, the line between sleep and wakefulness becomes blurred. They may appear to be asleep but still respond slightly when spoken to or touched. Some families might worry that their loved one is sleeping too much or think they need to be more active. It's natural to want to keep them engaged, moving, and alert. But the truth is, pushing them to stay awake or be more involved can create stress or discomfort. Instead, honoring their need to rest is one of the kindest things you can do. Another part of this shift includes changes in the body's natural circadian rhythm. The internal clock that once kept them alert during the day and sleepy at night can become disrupted. They might be wide awake in the early hours of the morning and deeply tired mid-afternoon. Some may also experience periods of restlessness at night, known as sundowning, where confusion and agitation rise as daylight fades. It's also worth noting that increased sleep can be emotionally difficult for loved ones to witness. It may feel like they're slipping away or missing out on valuable time together. And in many ways, that's true, but not because they don't want to be present. Their body is guiding them through a transition that none of us can fully control. Instead of trying to change their sleep habits, focus on creating a peaceful and supportive environment. Keep their room quiet and calm, use soft lighting, and ensure they are physically comfortable. Be there when they are awake, even if just for a few minutes. Those small shared moments, holding hands, a gentle smile, or quiet conversation, can mean everything. Recognizing these changes in sleep is a powerful reminder that your loved one is entering a new phase. And while it can be hard to accept, it also gives you the chance to offer grace, compassion, and presence in the moments that truly matter. A final sign that someone is nearing the end of life, often appearing in the year leading up to this stage, is a noticeable decrease in interest in activities and a strong desire for solitude. Many elderly individuals, especially those with a deep sense of community or an active lifestyle in the past, may begin to withdraw from the things they once enjoyed. This includes hobbies, social gatherings, and even daily activities they used to find fulfilling. At first glance, this can be mistaken for simple aging or a change in personality, but it's often much more profound. As the body prepares for its final phase, the mind and spirit start to shift focus. A person nearing the end of life may lose interest in hobbies they once loved, whether that's reading, gardening, knitting, or even going for walks. They may no longer find pleasure in things that previously brought them joy, and instead, a general sense of apathy or indifference can take hold. This behavior may be linked to the body's energy conservation process. As the body slows down and prepares for its final transition, it begins to allocate energy towards survival rather than pleasure. This shift means that activities that were once stimulating or engaging are no longer prioritized. The individual may not have the physical or mental energy to participate in what used to bring them joy. Alongside this loss of interest in activities is a growing desire for solitude. Elderly individuals nearing the end of life may prefer to be alone more often, seeking quiet, undisturbed spaces. This desire for solitude is not a reflection of disinterest in their loved ones, but rather a natural part of the transition process. As the body and mind slow down, the need for internal reflection or rest becomes stronger than the desire for external interactions. Social gatherings that once brought excitement may now feel overwhelming or draining. Conversations that used to flow naturally may become tiresome or difficult to engage in, leading to withdrawal. It's not uncommon for individuals to stop initiating social interactions, and they may show signs of discomfort when family or friends try to engage them in activities or conversations. For families, watching a loved one pull away can be painful. It may feel like a form of loss even before death occurs. However, it's crucial to understand that these actions are not a personal rejection or a sign of emotional distress. Rather, they are a reflection of the person's body and mind preparing for the inevitable. The shift towards solitude is part of the process of letting go, both physically and emotionally. Instead of trying to force your loved one back into social situations or encouraging them to be more active than they are capable of, the best approach is to honor their need for peace and quiet. Allow them to rest without pressure, but also offer gentle companionship when they are open to it. Even in moments of silence or inactivity, your presence can be a powerful source of comfort. While it's difficult to witness the gradual withdrawal of someone you love, recognizing it as part of the natural end-of-life process can help bring clarity. These moments of solitude are the person's way of saying goodbye to the world on their terms. By respecting this, you give them the gift of dignity and space during their final months.